This is KTVO's Good Morning Heartland.
And welcome back. Flu season is here. It's something we hear about every fall, but do you really know much about the flu? We have Dr. Puckett here from Complete Family Medicine to tell us more about it. How are you doing?
Doing well this morning, thank you.
Good. Well, first of all, what are the symptoms people should look out for if they know if it's the common cold or the flu?
Well, unfortunately, many of the symptoms are similar.
Okay.
Joint aches and pains, high fever, stuffy head, and then really some of the differentiating symptoms is kind of more of chest congestion and chest pressure. And
who should get the vaccine?
Well, everybody should get the vaccine who's over the age of 6 months unless they have a strong contraindication, and those are exceptionally rare. So everyone from 6 months on up.
All right. And I've heard that there are some new shots. Is this correct?
Yeah, we actually kind of have all the vaccine, the material that's in the shot is essentially the same. Mm-hmm. There's two major types. There's the nose spray, the nasal spray called Flu Mist, that is a live attenuated vaccine. So the virus in that spray is actually alive, but it's just the scientists have used special lasers to blow its arms and legs off, so it's not quite so bothersome to us. And then there is the dead virus, and this year the dead virus is available in the old shot in the muscle, but then it also comes in a new shot that's got a very short needle that just goes underneath the skin, and then there's a higher dose flu for those older than age 65.
And when you go in, do you have to ask for these types of flu shots, or what do you recommend?
Well, any of the flu shot is better than no flu shot, but I certainly would recommend that anybody getting over the age of 65 get the higher dose flu shot.
Okay, and tell us a little bit more about the new transdermal or under the skin shot.
Yeah, it's a nifty device. It's just a very, very short, small needle. You hardly feel the prick at all in your arm, and then it just delivers the vaccine right under your skin. And so instead of having it deep in the muscle where your muscle kind of aches for a day or so, this just kind of provides more of the medicine right under the skin. The next day it may look like a little bit of a bee sting with a little red area, but patients are telling us that that the pain is much less.
Oh, well, that's good, especially if a lot of people are scared of getting the flu shot just because they think that they're going to have that soreness or so afterwards. Now, everybody says, oh, you're going to get sick if you get the flu shot. Is that true?
With the live attenuated, the nasal spray, it does, you do get a little bit of maybe some joint aches and some stuffiness, a very low grade fever, but that's just the vaccine working in your body and your body responding and getting ready in case the real flu comes. The symptoms are much, much less than what would be if you had the flu, and they're very limited in time frame. And with the dead virus, any of the shots, any type of those symptoms are just very rare. The biggest issue is just that pain in your arm where you got the shot.
Right. And there's a new study that's saying that these shots aren't working quite as well as they used to. Is that true? And should
I think there was kind of a public perception that flu shots worked 100%. And so I don't want people to be alarmed, though. 60 or 70% effectiveness from the flu shot is actually pretty good. And if enough of us get it, then we just won't let it come to town. So I think that even though it's maybe not 100% effective, that 50 to 60% effectiveness is really still important. We only have to vaccinate around 40 people to protect one person. That's pretty remarkable. There's a lot of other things in medicine where we have to do hundreds and thousands of people to get effectiveness. So it just takes 40 of us to get the shot, and then we'll protect one person.
Okay. And I actually went into urgent care 2 weeks ago because I thought I had the flu. So before I got the flu shot, they actually tested me for the flu. Can you kind of maybe let our viewers know? Because I did not know that there was a test for that. So can you kind of let our viewers know what that entails?
Yep. And actually, we got our first flu positive test yesterday. So it is here. Still sporadic. But it's coming to the heartland. The flu test is just a simple nasal swab and takes about 15 minutes for the results to come back. We can test for the two varieties of flu, influenza A and influenza B, and have that result. And if we need to make treatment from there, we can.
Okay, and we actually have a map if we can put that up, and like you said, what is this?
This map just is showing where there's flu view, where there's activity. It's available on the CDC's website, and you can see that Missouri is still in the sporadic range, but there are some places where it's regional and widespread. So it's coming. We're early in the flu season. Usually we see the big hit here a few months from now, even in January and February. So the key thing is to get your flu shot, get it now.
All right, and of course they're all available all across the Heartland at your doctor's office, at the Adair County Flu
Health Department, at any doctor's office, at pharmacies.
Okay, and do we have to be a patient in order to come and get the flu shot at your place?
Nope, just come on in. We'll get you taken care of.
All right, perfect. Thank you so much.
Okay, thank you.
We'll post all of this on our website at heartlandconnection.com, and we'll also post all your information as well as a link to your website on our website for our viewers. Okay.
Great, thank you.
Thank you for your time, and we're going to